Cholera and the Outbreak in Haiti by Nicole Robbins. What is cholera? Cholera is an acute bacterial infection that affects the human gastrointestinal system. The bacteria is called Vibrio cholerae. The bacteria is found within contaminated food and water sources. Areas of low socioeconomic status, poor sanitation systems, and lack of consumable water are at most risk. The World Health Organization International Classification of Diseases has their 10th revision of the ICD. Vibrio cholerae is ICD-10A00. Cholera infectious agent. There are two serogroups of Vibrio cholerae, O1 and O139. Two major serotypes, Inaba and Agawa. Both biotypes are similar. They share an almost synonymous enterotoxin. Identification of Vibrio cholerae. Asymptomatic infection tends to be more frequent, but Vibrio cholerae bacteria can be present within the feces for 7 to 14 days. More serious forms of the infection will bring on sudden symptoms, and when untreated, the rate of fatality significantly increases. Symptoms include profuse watery stools and vomiting, and dehydration will then become very severe within the first 12 to 24 hours. Dehydration symptoms include fatigue, dry and wrinkled skin, headache, lightheadedness, sunken eyes, fever, rapid heart rate, and low blood pressure. Cholera incubation period can be anywhere from a few hours to 5 days. The average is between 2 and 3 days. Mode of transmission. Cholera bacterium can be transported through vomitous remains and/or through the feces. It can also be ingested through contaminated food products or water, through unsanitary hands, or unclean surfaces for food preparation. Lamond and Kinyanjoy discuss 4 different transmissions: contaminated food or water, person-to-person or direct contact through contaminated parts of the body such as the hands, infected corpses and their bodily fluids, and treatment centers with inadequate hygiene and sanitation. Treatment. Successfully treated with prompt rehydration, oral rehydration, or intravenous rehydration for more severe cases. Antibiotics are available for symptoms that do persist, but according to the World Health Organization, antibiotics are not as essential as rehydration is. Cholera in Haiti following the 2010 earthquake. What led to the cholera outbreak in Haiti? On January 12, 2010, a 7.0 magnitude earthquake devastated an already troubled nation. It has been estimated that a $7.8 billion worth of damage has been done. The epicenter of the earthquake was just 16 miles west of Port-au-Prince, Haiti's capital. According to the World Health Organization, prior to the earthquake, 64% of the population had access to clean drinking water and 26% had adequate sanitation facilities. Following an earthquake, water sources were certainly compromised. Latrines and pits for defecation eventually overflow and bring fecal matter towards the water sources. John Wilson of the Mayo Clinic said, "It becomes the perfect setup for this to transmit very, very rapidly," regarding the Vibrio cholerae bacterium. Lack of safe water and sanitation systems amplified the outbreak. 2 ideas of what caused the outbreak are below. First, brought to Haiti by outside individuals, or 2, the bacterium was lying dormant within nearby waters and then the earthquake created a form of activation to cause the outbreak. Source of the outbreak: relief efforts. Soldiers from Nepal were said to have been infected with cholera, and they were accused of dumping waste tank contents illegally. It was also said that there was a cholera outbreak in Nepal's capital city shortly before soldier departure for Haiti. UCLA has released two hypotheses for the source of the outbreak: human causal hypothesis, the source being Nepal, and climatic causal hypothesis, which is Vibrio cholerae bacterium was dormant in nearby waters. Human rights activists have decided to file a lawsuit against the United Nations. The United Nations is being held responsible for dispatching Nepalese soldiers over to Haiti following the earthquake for relief efforts. The lawsuit was filed in New York this past October. There are many conditions and risk factors that influence the spread of cholera, such as poor sanitation facilities, polluted drinking, cooking, and bathing water, environmental conditions, lack of proper health care, facilities, tools, medications, and other necessary items to treat and control cholera. And it was said that there has been an underinvestment in the health system regarding Haiti's health system and their health care programs. Methods of control. Haiti is currently trying to develop a nationwide water and sanitation system, which will certainly take plenty of time to complete. But they're also looking to improve their healthcare system, educate the public about cholera and proper hygiene and sanitation, train doctors, nurses, and other health professionals to handle, treat, prevent, and contain cholera, continued support from outside groups, household solutions such as water filters and water purification tablets, and surveillance systems to monitor the nearby waters in Haiti. United Nations Millennium Development Goals include 73% of the population to have access to clean drinking water by 2015 and 60% of the people to have adequate sewage by 2015. Prevention of future outbreaks. Vaccination has been available for those who are at risk, but it's also important to have continued education for the public and medical professionals, and a screening policy should be in place for disaster relief workers to prevent any person or persons to go to an area that has been devastated by a natural disaster and possibly spread some form of infection like cholera. There also needs to be continued efforts to advance medical treatment, continued efforts to improve risk factors and conditions. But those who are traveling to Haiti or other infected countries are urged to take many precautions, such as using water purification tablets, bottled water for drinking, to wash food, to make ice, and other hygiene practices like brushing teeth. Practice good hygiene and avoid raw foods such as fruits and vegetables. The next two slides include all my references for this project. And below is the microscope image reference that I used in the beginning of my presentation. Thanks for watching.